HBCU Digest Radio, welcome back to our HBCU Voices of STEM Excellence series, profiling the best and brightest within the historically black college and university sector. Today we have an extraordinary guest who's going to be talking about a monumental undertaking for the Morehouse School of Medicine. James W. Lillard is the Associate Dean for Research at the MSM, also a professor in microbiology, biochemistry, and immunology. And he is part of a team leading an effort with the AACR, the American Association for Cancer Research, which is going to, by the year 2020, work with 2020 consented African American cancer patients to sequence their, and I want to get this right, Doc, their genetic data to compare it and broaden our scope and view of what it takes to treat and potentially cure cancer, particularly in African American patients, correct?
Yes, that's great summary.
I'm trying, man. Y'all are the geniuses. I'm just trying to keep up. So, Dr. Lillard, indeed an honor to have you on. Talk to us about this partnership, because this is huge. And for one of the handful of historically black medical schools that we have to play a central role in cultivating this genetic data, how did this come about? And, for the laypersons like me, explain exactly what the project is.
Right. So, well, we're part of a larger network called the Oncology Research Information Exchange Network, abbreviated as ORION. It consists of 18 comprehensive cancer centers, academic comprehensive cancer centers, plus Morehouse School of Medicine as the only HBCU minority serving institution in this network. So together, we're hoping to better democratize precision medicine and make it more available for cancer patients, with the hope of identifying new biomarkers, possibly new drug targets, as well as developing methods to better match cancer patients to possibly life-saving clinical studies.
Now, we were talking offline before about just how important this work is and what the number 2020 represents. So can you talk a little bit about those population disparities in terms of available, cancer-related data points for African Americans and how this particular initiative will really shrink that space?
Right. So, as part of this overall movement, if you will, to in precision medicine and cancer, over the last 10 to 15 years, scientists around the country have been doing similar studies, but have predominantly been looking at Caucasian Americans instead of African Americans largely. Just to give you an idea, while in the United States, African Americans represent roughly 13% of the population. However, in these large molecular data sets, only 3% of the cases represented are from African Americans. Okay, so that's over a fourfold difference. And when you consider in the state like Georgia, where African Americans represent 32% of the population here in Georgia, you can see how much of a disparity that is. So what can happen is that in these data sets that scientists are studying, if African Americans aren't represented, we may overlook potential biomarkers that may be more prevalent in African Americans to diagnose cancer, or we may overlook genetic variants, gene variants that might be drug targets that might work optimally in different patients like ours. What could end up happening is creating a kind of unintended health disparity of the future if we're not actively involved in contributing to these precision medicine initiatives.
Well, that's the big thing. And these are going to be sequencing, as you explained it to me, sequencing cancer survivors and their data. Can you explain what sequencing is all about and why it matters in trying to get folks signed up and enthusiastic about participating in the initiative to make sure that more people, millions of people, can benefit as a result.
Okay. Well, sure. So, and so DNA is, I guess, could be considered kind of the blueprint of all of us. And, perhaps nothing is more personal or precise as that unique gene sequence and that exists from person to person. So the same thing, the DNA that makes you unique can be mutated in a cancer to cause a cancer. And that's exactly what we're looking for. The blueprint of the cancers or the tumors that pop up, as well as the genes that are expressed by those tumors. And that's how, and we're sequencing those nucleic acid by nucleic acid. And it's essentially, just to give you an idea, it's terabytes of data, several terabytes of data per patient. So we're, in order to make sense of all of that, we have to not only sequence the germline, or kind of what's considered like the baseline DNA before it is expressed by the person, as well as the cancer cell, a normal cell versus the malignant cell. Mm-hmm. And we're also sequencing all of the genes expressed normally versus those that are expressed only by the tumor cell. And then what we end up seeing, things that shouldn't be expressed are expressed, things that should be expressed are significantly downregulated or even mutated, and resulting in the various differences in cancer subtypes we see, even within a given cancer. So, for an example, like prostate cancer can vary even within a person and from person to person, and can range from almost an indolent disease to something extremely aggressive and life-threatening.
How does Morehouse become connected with the AACR and with a monumental project like this? Obviously, there are leadership positions, but obviously you got to have African Americans advocating for this kind of research to be done. Otherwise, it may not get done. And if you think about the small number of HBCU medical schools we have, you can imagine how tall of an order that is. So what was it that the school and yourself were able to do to position this work and the necessity of it in front of a group like AACR to get it done and launched and support it?
Right. Well, I wouldn't say that we went out looking for this type of support per se, but we've been leading in this area for quite some time. And it's a team, it's not just myself, but we've got a relatively new director of our Cancer Health Equity Institute, Brian Rivers. He plays leadership role at AACR. I'll also say that it's also important leadership from the president-elect at that time, Mike Caligiuri, who's now at the City of Hope as its CEO. Also recognize Morehouse School of Medicine's efforts in cancer health equity and help make this award possible.
And in the end, this is an initiative that's to conclude in 2020. That's right around the corner in medical time.
Oh yeah.
What will be the expectation, or how will you know that this has been successful? Is it just the number or being able to curate the 2020 patients, or is there a data set that you hypothesize you'll arrive at, or a certain amount of facts you'll gather? What will have made this initiative successful and able to be translated to the medical community, particularly in treatment for Black folks?
Right. Now, this 2,000 specimens or sequencing sets is our first milestone. I hope to exceed that here at Morehouse School of Medicine through important community partner relationships where we can partner with other community oncology practices that make it part of our network. And just, I want to try to put things into perspective. It's a little difficult, but there was a recent study conducted that did a pretty good job of showing how many cases are necessary or needed to kind of level the playing field, if you will, when we consider the deficit or shortage of African American cases compared to European American cases. If we could just sequence another 300 to 400 African American lung cancer cases, for example, in the country, we could begin to level that playing field and see parity and have enough statistical representation to be able to make better calls in terms of biomarkers and drug targets.
And then the final
that gives. Yeah.
Oh, absolutely. And then the final thing, again, we're honored to have you on today. If people want to know more about this particular initiative, I know the AACR has a lot of links and a lot of literature on it, but how can folks find out more about this work and other work going on at MSM, and how can they support it? How can they donate? How can they become participants or possibly contact family about being a part of the data gathering process? What can we do to be more a part of your work?
Oh, thanks for asking. You could visit our Morehouse School of Medicine website, where you can make a donation and learn more about this total cancer care protocol at Morehouse School of Medicine. Now, it's important that we have to partner with hospital systems and healthcare systems where an individual may be receiving cancer care. So we have select partners at the time being that we're working with. For example, we've launched the study initially at Grady Health Systems, or Grady Memorial Hospital, one of the largest safety net hospitals in metropolitan Atlanta, and actually in the South, one of the largest safety net hospitals in the South, where there are around 1,100 new analytic or new cancer cases annually.